Mechanism of action. A 55-year-old man undergoes liver transplantation and is started on tacrolimus to prevent organ rejection. This medication exerts its immunosuppressive effects through which of the following mechanisms? A. Inhibition of IL-2 receptor on T cells. B. Inhibition of calcineurin by binding cyclophilin C. Inhibition of calcineurin by binding FK binding protein, FKBP. D. Inhibition of purine synthesis via inosine monophosphate dehydrogenase. E. Inhibition of mTOR signaling pathway. Correct answer C. Inhibition of calcineurin by binding FK binding protein. FK explanation. Tacrolimus is a calcineurin inhibitor. It binds to FKP FK506 binding protein, which leads to inhibition of calcineurin. This blocks NFAT activation and ultimately IL-2 transcription, suppressing T cell activation. Why not the others? A describes daclizumab or basiliximab. B describes cyclosporine, not tacrolimus. D describes mycophenolate mofetil. E describes sirolimus. Question 2. Adverse effects. A patient on immunosuppressive therapy after renal transplant develops worsening hypertension and a rise in serum creatinine. He is also experiencing tremors. He is currently taking prednisone and tacrolimus. Which of the following is the most likely cause of his symptoms? A. Opportunistic CMV infection. B. Acute transplant rejection. C. Tacrolimus-induced nephrotoxicity and neurotoxicity. D. Steroid-induced Cushing syndrome. E. Cyclosporin gingival hyperplasia. Correct answer C. Tacrolimus-induced nephrotoxicity and neurotoxicity. Explanation. Tacrolimus, like cyclosporine, causes nephrotoxicity via renal vasoconstriction. It is also known for neurotoxicity, tremor, headache, seizures. Hypertension and creatinine are hallmark signs of calcineurin inhibitor toxicity. Why not the others? A. CMV would present with fever, GI symptoms, or cytopenias. B. Rejection would likely be accompanied by systemic signs and biopsy findings. No signs like weight gain or striae are mentioned. E. Gingival hyperplasia is more common with cyclosporin, not tacrolimus.